Now, next I'm going to percuss the posterior and lateral lung fields. Okay, next I'm going to percuss for the diaphragmatic excursion. Sir, I'm going to ask you to exhale and hold it. Okay, here we go. Again. Okay. Now I'm going to percuss the costovertebral angle. Okay. I'm going to listen now to his posterior, or auscultate his posterior lung fields. So take a deep breath. And out. Again. Out. Again. Okay. Now the anterior. Okay. Now the next part of his body that I'm going to assess is his heart. And I'm going to auscultate in the precordium in 5 places with the diaphragm and also with the bell. So you can sit this way, sir. Just breathe normal. Okay, and also I would listen for any murmurs as well. So I'm going to ask the patient to lean forward, and as he leans forward, I'm going to ask him to exhale, and I'm going to listen the base of the heart for any murmurs. So go ahead, lean forward, exhale. Okay, you can sit upright. Okay. So also I would auscultate the precordium at all 5 sites with the diaphragm and bell, and auscultating the apex for murmurs with the patient lying on his left side. The next part of the assessment would be his abdomen. And with the abdomen, I would inspect his skin, his umbilical, the umbilicus for contour and pulsations. I would listen to all of his, the 4 quadrants of his abdomen. Vascular sounds I would listen for too, over the aorta and renal arteries. Also, I would percuss the quadrants, percussion of the location of the spleen, liver and kidneys, and palpation of femoral pulses bilaterally. And in order to assess his abdomen, what I would want to do first is I would inspect it to look at the contour, to see if he's got any issues going on with the skin, looking for distension, non-distension. Also, the next thing that I would do is auscultate his 4 quadrants to listen for bowel sounds. I would percuss also his abdomen, the 4 quadrants. And lastly, I would palpate to check for any tenderness that he may be having. And obviously, if he tells me that he's having tenderness in one of the quadrants, I would do that last, and I would do it gently. Or stay away from it if he is really in pain. So the next thing that I would move to is the upper extremities. So I'm going to go ahead and ask you to put your arms out. And I'm inspecting his skin. Okay, his skin looks good. He is symmetrical. Okay, you can put your arm down. I'm going to go ahead and lift this. I want to look at his nail beds and assess his capillary refill. The same over here. Okay. So another thing that I would also inspect up here is his radial pulses. Brachial. Okay, put your arms down. And also I'm going to test his coordination. I'm going to ask the patient to touch his nose with alternating fingers. So with your right hand, I'm going to ask you to touch your nose with your alternating fingers. Okay? And now with the other one. Okay? All right, now for the lower extremities, I'm going to ask you to go ahead and extend your legs out. And I would check his skin. I would pull up, the pants and look at his skin to see if he's got any skin problems going on. Go ahead and extend your legs again, looking for symmetry. Okay. Leave your legs like that. And also, I am going to palpate his pulses. So in the popliteal. Okay. And the next ones that I would palpate for is the posterior tibial. Dorsalis pedis. Okay. Okay, so next I'm going to test for sensation down in his lower extremities as well. So I'm going to ask him to close his eyes. Okay. Well, you tell me if you can feel me touching.
Yes. 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 Yes.
Okay. You can open your eyes now. All right, so the next thing I'm going to ask is that go ahead and close your eyes again. Can you feel me touching here,
Yes.
here?
Yes. Yes. Yes.
Okay. Keep your eyes closed. Now I'm going to test his toe, his great toe, and he is going to tell me if it's being moved up or down.
Up. Down.
Okay, so I'm gonna ask him to stand. You can open your eyes now. Okay, and I would inspect, I mean, if he didn't have the pants, I would look for any, if he's having any problems with veins or anything of that sort. You can go ahead and sit down. So the next thing I'm testing for then is the Romberg test. And I'm going to assess for cerebellar function. And for this, sir, I'm gonna ask that you stand with your feet together. Okay, arms on the side. I'm gonna ask you to close your eyes and stand like that in the same position for 20 seconds. Okay. All right, so you can go ahead and have a seat. All right, so now I'm going to move on to his, to the musculoskeletal. So I'm going to assess his shoulders, chest, okay, arms, legs. So now what I'm going to ask you to do is I'm going to ask you to stand again, okay? I'm going to ask you to move your arms straight up, high above the head, okay? Now I'm going to ask you to put them behind your back, and this way. Arms behind your back, okay? Now to your side. Then I'm going to have you raise your arms and touch fingers, okay? And then place hands behind your head. Okay, now you can put your arms down. Now I'm going to ask you to, with your right arm, I'm going to ask you to straighten it out. Now bend at the elbow. Now straighten it out. You can put it down. Same thing with your left arm. Straight out, bend at the elbow. Okay, put it down. Okay. Also, and I'm going to ask you to flex and extend your wrist. We're going to start with your right. Flex and extend. Okay, put that down. And the next one. Now your fingers. Flex and extend. Flex. Okay, you can put your hands down. The next thing we're going to test for is his arm strength. So we're going to ask him to, he's going to push out. Good. Pull. Okay, now on this side. Push out. Pull. Okay, so the same thing we're going to do when he, this time flexing your arm. Okay, so go ahead and push. Pull. This one. Push. Pull. Okay, now here at the wrist. Push. Pull. Push. Pull. Good. Now I'm going to ask you, I'm going to inspect his spine. So I'm going to ask you to turn this way and go ahead and bend at the waist a little bit more. And I'm assessing the spine, the curvature of his spine, make sure it's nice and straight. Okay, you can stand up. Now I'm going to ask him to, he's going to stand straight like this. Okay. And we're going to test his range of motion of his hips. Sir, I'm going to ask you to bend backwards. Okay, now you can stand up straight. And you're going to bend side to side. Okay, stop. And I'm going to have you rotate your shoulder. We'll start with your right shoulder. Rotate your shoulder. Okay, now the other one. Good. Now I'm gonna ask you, I'm gonna assess his gait. I'm gonna ask him to walk across the room, heel to toe. So sir, I'm gonna have you stand right here. I'm gonna have you take some steps forward. And stop. Now I'm gonna ask you to walk back a few steps on tiptoe. Okay, you can stop. And now on your heels, walk backwards. Okay, you can stop. Then I'm gonna ask you to bend slightly at the knees and then stand up straight. Okay, you can go ahead and have a seat. Now, another part of the assessment that is important is always educating our patients about female or male issues that they may have. And in this case, well, we have a male patient, and for him, I would instruct him how to perform a testicular self-exam. So, what I would tell him is that it is good for a testicular self-exam. It is good to do it at least once a month. And a good time to do it is when you're either during taking a bath or a shower, when your hands are warm and soapy and the scrotum is warm and relaxed as well. It is a rather simple procedure. What you need to do is hold the scrotum in the palm of your hand and gently with your thumb and your two first fingers to feel gently, okay, each testicle. If it hurts, you're probably pressing too hard, okay? The testicle feels it's like egg-shaped. It is movable, it's rubbery and smooth. If at any point you feel a firm, painless lump or a hard area or an enlarged testicle in general, you're gonna want to notify the doctor of these changes, and so that he or she can give you a further checkup on it. Okay, do you have any questions about that?
No.
No? Okay, and also another point to talk about to the male patient is about prostate changes. I would ask him about if he's having any issues during urination, such as leaking or dribbling, a weak urinary stream, urinary frequency, especially at night. And if any of those changes are going on, you're going to want to also notify your doctor as well of these changes so that further testing can take place. So this concludes the head to toe assessment. Thank you and have a blessed day.